Hi, everyone. Welcome to The Experts with Dr. Jenelle Kim, and I am here with Dr. Jonathan Levine, a fast friend of mine. I was able to meet him yesterday. I'm not going to go into it because then I won't read his amazing bio because we're going to talk about it in a bit. But amazing, amazing man. Let me tell you a bit about him if you don't know who he is, which would be shocking. Okay. So I am so honored to welcome a true pioneer in the world of modern dentistry and wellness, Dr. Jonathan Levine. Dr. Levine is not only a world-renowned prosthodontist, which you will tell us about this, with over 35 years of experience, but also a visionary entrepreneur, innovator, and philanthropist. He's the founder of JBL, New York City, and Smile House Tribeca. Now that's where I had the amazing opportunity to go there yesterday, so we will definitely talk about this, where he is redefining oral health by bridging aesthetics, technology, and total well-being. That is key. Dr. Levine completed his undergraduate studies at Cornell University, where he majored in microbiology. During his time at Cornell, he was also a two-time All-American lacrosse player, leading his team to a national championship in his senior year. And his amazing boys followed suit, which he just shared with me. He then earned his doctorate of dental medicine degree from Boston University's Goldman School of Dental Medicine. Furthering his specialization, Dr. Levine pursued postgraduate training in prosthodontics at New York University. NYU. Smile House, as I said, I had the amazing opportunity to experience it just yesterday, is pioneering a precision-based approach to oral health and whole body wellness. Dr. Levine and his amazing team are integrating the latest advancements in all dental specialties, diagnostics, and personalized care. A hallmark of Smile House is the mouth mapping diagnostic process, which I did, developed by Dr. Levine to assess oral health across aesthetics, structure, function, and biology. Memorize that, the 4 pillars, all right? Providing patients with a detailed understanding of their oral wellness. He believes that your smile is more than just aesthetics. It is a gateway to longevity. I love that. So true. With over 29 patents in oral care, how do you do other things? I mean, you just do patents. 29 patents. That's the whole thing, Dr. Levine. Okay, if people who don't understand. He's also the brilliant mind behind the Glow Science, bringing professional level teeth whitening to people everywhere. But what makes Dr. Levine truly special is his heart. Alongside his wife, he co-founded the Glow Good Foundation, delivering life-changing dental care to underserved communities around the world. His work is grounded in purpose, passion, and a deep belief in the power of a smile, not just to transform appearances, but to transform lives. Dr. Levine is here with us today to share his wisdom of innovation, service, and the beautiful connection between oral health and overall wellness. Welcome, Dr. Levine.
Oh, thank you.
Really impressive,
Thank you for
seriously. And I was just telling you, because you, when you first walked in, said that you knew someone that I interviewed very well, and that's Frederick Fekkai, who is like an icon in the hair care world. You're an icon in the dentistry world. And I was saying it, he's someone that I speak of often because he was just one of the kindest, most authentic, loved his story, connected immediately. And that doesn't happen all the time, but I certainly felt that with you. And so I'm grateful.
Yeah.
We will know each other for a long time, you and your beautiful family.
Thank you.
So I am happy to have you here.
Well, I'm excited to be here. And when I started looking at the people you've interviewed and I saw that you had Frederick on, you know, he's one of those entrepreneurs that embodies that beautiful, humble and hungry at the same time, ambitious. And he's done so much in his career. And he's been a friend of mine since that long, like 35 years. So, you know, it's we all kind of go after it within our industries.
Right. And how beautiful to know that each other have been there throughout the whole process because, you know, I'm a bit behind you all. But 20 years, you know, that's not like 5.
Hey, that's not a sneeze.
So I love hearing this, though. And now I am inspired by individuals such as yourself. So before we begin, I first want to, with all the things, Smile House and so much, holistic dentistry and oral health. Right. I first want to ask you, so what were you like as a child, Dr. Levine? What brought you here? Why are you doing this?
Wow. Okay.
Yeah, welcome. I
need to be on a couch right now.
I know. Well, we're going to have to move the set.
We're going to move.
Yeah.
Yeah. Well, you know, it's funny. I have a fraternal twin brother. And, you know, very interesting being a twin growing up. You know, everybody's comparing you.
Sure.
I had a dad who had, just may rest in peace, had a tremendous work ethic. So I think as a child, it's like you always get somebody to hang out with. You get your brother.
Yeah.
I was very into athletics, but at the same time also kind of academics. I also was into acting, so it was like, well, I had to make a choice at some point between athletics and then acting because you gotta make some choices. And I think I was that kind of kid who liked to explore, liked to do a lot of different things. And then I had a mom who just was, lived for her children. So it was that kind of family.
Yeah.
A dad who traveled a lot, worked hard. A mom who kind of filled the void of dad not being around that much. And my brother and my older sister. And my older sister was 4 years older, so she was, not around once, you're kind of getting a little older. It's, 8th, 9th grade. So I always had my twin brother. And what happens as a twin, you don't have twins.
No, but I know a fair number of some of my best of friends are twins.
The worst thing people do is they compare.
Yep.
Who's taller, who's smarter, who's faster, who's this, who's that. And so it does set up a competition that is, I personally think not so healthy.
Yeah, understood.
Yeah.
Should I ask what your brother does?
My brother.
Is he in dentistry?
No.
Okay.
My family's a little crazy. A lot of people,
Love it.
doctors. My father has 2 sets of twins in his family.
Okay.
So I'm a twin.
Yep.
Fraternal. My father was an identical twin,
Yes.
and he's got a brother and sister fraternal twin. So,
Right.
so we got a lot of twins.
Yeah.
So I'm thinking my kids are having twins.
I was just going to say, like,
Right?
you didn't, but it skips generations. We know this. So,
Yeah, that's right.
genetics.
So I think something's coming, and I'm ready for grandchildren, by the way.
Yes.
Let's go, I tell my boys. But, the truth of the matter is that we have doctors, and my father was in one of the oldest businesses in the United States. It's called the furrier business, the fur business, raw skin dealer. And my brother, out of college, started to work with my dad. And then he's gone into other businesses in the fur business, but actually in other businesses where they take the blood of the rabbits and they use it in laboratories and blood serum and all of that.
Right.
So he's kind of evolved with that. But my funny story about my twin brother.
Thank you so much for tuning in to The Experts. I'm Dr. Jenelle Kim. I'm so grateful for you being here, listening to these amazing experts. The intention behind this episode is to bring you the knowledge, the wisdom, the experience of the expert and the source, to make things that much less overwhelming. And as a special thank you, I'd love to offer you a discount of 15% off on anything you can find on my website. I've created some amazing formulations for incredible brands carried all over the globe, found in Credo, Sephora, Ritz-Carlton, Whole Foods, you name it. And I have come out with a couple of hero products, if you will, because people have been asking for some decades. And so it's a muscle and joint product, some amazing face products where I combine the secret formulas and passed down my lineage with the best of the modern anti-aging ingredients. So for anyone that is interested, please use code DJK15 and you can help yourself to any of the products that you think will be effective in your life, as well as any of the courses, Qigong and breathwork.
Is that I'm going to fast forward to my senior year in college.
Can't wait.
And Cornell plays Maryland in the national championship game. And my mother, my Jewish mama, is on the field. It's the first time they televised the game, largest group of people ever to watch a lacrosse game up in Providence, Rhode Island. And my mother's on the field 2 minutes before the game. I go, Ma, what are you doing? You're going to get killed with a lacrosse ball. Get up in there. She goes, I'm so nervous. I go, what are you nervous about? She goes, I'm so nervous because I don't know what side of the field do I sit on. Do I sit on the Maryland side, University of Maryland? They were undefeated. Or do I sit on the Cornell side? We were undefeated. I said, you get up on the Cornell side, we'll be winning this game.
Yes.
And sure enough, double overtime, a nail biter. We did win the game.
Oh my God.
Bragging rights for the rest of my life.
Yeah, well, yeah, that'll do it. And I love your mom. I get it. I had like my son who plays basketball. He's 12. We're not there yet. He had a big like county championship game. And I found myself at one point, someone pushed him out. And it wasn't even about the pushing. I get that. Like, I'm a martial artist. I get that. It was more because I just want to make sure the ref saw that he pushed them.
Exactly. You're on your feet.
Without even thinking. I was like, I'm on video, like yelling this. I'm like, okay, well, that's the thing.
Exactly.
So I get it.
You and every
I love
parent.
your mom. True. It's not some, I love that. Okay. So how did you get to doing what you do? Did you like, when you were little, you were like, I'm going to be a Dentistry.
No. I was.
Prosthodontist.
I sat around the dinner table. This is what I think happens. Growing up, a lot of times you sit around the dinner table and you listen to the conversation around the dinner table, and we learn so much.
Yeah.
And we were talking about it a little bit before. It's kind of not what we say, but it's what we do, because the kids are always looking at the parents and the modeling from the parents. And my father's fur business was a crazy business, very, or unorthodox. Everybody owes each other money, not organized. And I said, this is business. And I said, I don't like business, I said to myself. And I really oriented myself more to like science and those kind of things. So I went to Cornell, and I was, kind of science, but I was also, of course, into athletics and playing lacrosse. And it was a process of elimination how I got into dentistry, because I hated hospitals, because my grandparents I was very close with both passed away while I was in high school. And then keep going, business. I didn't think I liked business. So, I was doing some sculpture, and I was working with my hands, and I was thinking of getting a PhD in biochemistry. It wasn't exciting enough. I didn't think that I would be into that. And I went into dentistry. I get out of dentistry, out of dental school. I went to a fantastic dental school, postgraduate dental school. In other words, everybody becomes a specialist. Small class, 37, Goldman School. Now it's a larger class. And
that's pretty cool.
I got out, and I realized that I got to know business, and I start realizing that anything you go into, like I learned from lacrosse, is a team sport. Life's a team sport. And the industry was very siloed, very individualistic, solo climbers. And I said, oh, my God, this is the profession. And so I literally started to reinvent the profession for me. From day one, we got to build teams, and I was always of the mindset of really pushing boundaries, of taking risk, of doing different things within the industry. And I was very well trained on the pre-doctoral dentistry side.
Right.
But then I felt that there was more, and then I ended up specializing about 4 years after I was out practicing.
Yeah, let it be known time and time again. I mean, this is the experts, and the purpose of the show is to go to the source. Coming from a lineage, I talk about like the source of the knowledge and the people who have been around and they know. So, but I absolutely love that. I love that. And one of the things that you hear often is, I took a risk. It's almost like, of course, people know this, but time and time again, it's the number one thing. Yeah. And you push the boundaries, and you saw what resonated with you and what you felt was missing, and you made it, as my father taught me, like you make it your own. Like that's how you truly become probably an expert, he would say. He didn't use those words in life. Like you make it your own.
That's it. Yeah. And fear doesn't hold you back. Everybody has fear to a degree. Yes. I had an amazing coach in college. We were talking a little bit before, but this coach, Richie Moran, who was the John Wooden of lacrosse, who pushed us, put together a bunch of young guys from Long Island who ended up playing together. And by the time we were seniors, we were the best team in the country. But we learned something together. And what we learned was that by working together and having a common goal and having a common value system, we really loved each other. We had each other's back. Yeah, we say rope holders, right? And we really did. Yeah. And so when I got into the profession, I saw it was such a solo sport. I said, we got to build teams. And what I mean by that is, if you're a prosthodontist, that's what I do. So I'm the guy who does aesthetics, but also all these other structural type things and really understanding function and how teeth come together. But we work with the person who, let's say, places an implant or health of the gums or moves the teeth like an orthodontist. Right. And so there's this multi-specialty approach at the high end of dentistry, just like there is in medicine. Primary care physician
that is key.
Refers to specialists within the profession. Dentistry, it's a little bit more nuanced, where it's more in the last kind of 20 years that the specialties are emerging. And so my big idea was we're putting everybody under one roof because you got to be able to collaborate. If I send cases for 20 years, I did this to my periodontist, they're not back to you in time. They lose the x-rays. You end up losing the patient a lot of times because they'll put them into their hygiene program. So you're not really seeing your cases timely. Y'all got to live together. You all got to be under one roof, just like medicine is. Because what has happened hundreds of years ago, but a long time ago politically, dentistry and medicine is separated. Right. And they need to be connected because the body, as we all know, is an ecosystem. Yes. And everything is connected.
I know.
Yeah.
I know you know.
You know. We're underlining it
Yes,
together.
no, and it's so important because one of the things, I mean, just at face value, exactly what I'm talking about is we say these things, but we have to stop at times. I do this all the time. I mean, I literally sleep it, eat it, breathe it, like it's literally my life, but I still stop and think about what I'm saying, you know? It really is all connected. We are mind, body, spirit. You're also talking about teams. That's just one level of connection outside of ourselves, you know, working together. And I absolutely love that. And I saw it yesterday. I went to Smile House, which we will talk a bit about, well, probably more than a bit, yesterday in Tribeca, the soft launch. I was so grateful. And your team was amazing, and you could feel that. And I felt, as you saw, I didn't have too much to do, which is never the case. And so I didn't want to leave. I was like, just leave me here.
Well, we didn't want you to leave.
The weighted blanket and all the beauty. And it's so beautiful. Okay, we will get into that. Yeah. But I saw the team, and I think that's so important and makes so much sense.
Yeah.
And I have to acknowledge that, you know, you brought up how important athletics and being in teams, you know, growing up. And so really, I was going to say, and didn't want to cut you off when you were speaking, but that also 100%, how can I say, probably set a foundation, helps you to see 100%. At a young age exactly what you have brought to life.
It was incredibly foundational.
Everyone has their role and their place.
Exactly. And it speaks to doing anything in life that you're building.
Yes.
Because if you believe that life is a team sport,
yes.
and so is whatever you're building, whether it's a young company, and I've started a bunch of different startups and involved with startups today, the culture of the company, how the people feel about each other. We say, set your vision, your purpose, why you do what you do, and what's your value system. And you set these parameters. What you can create is a very inspiring culture.
Yes.
And that's when people perform at the highest
Absolutely.
level. That's when they're happiest.
Right.
That's when you don't have staff turnover, because company is culture, as we know.
Yeah.
And I got that from athletics, because if you have a team and you have some infighting, game over.
Yeah.
You're not winning. You can have the best player in the league,
right.
But if you don't have the ability, I'm not going to name names of some famous basketball players.
I'm already thinking,
who've been solo
yeah.
players. Those teams are not going to win national championships or championships. They're just not.
Absolutely.
It's always about having each other's back and having that culture that you inspire each other to get to that next level.
Yeah, I love that. And I felt that, and it really made me not want to leave. And listen, at this point in our world, if we can have any place that exudes that kind of connection and that team and that enjoyment of being together and caring is key, then literally no one wants to leave.
That's it. That's it.
So you know where to go, Smile House in Tribeca. But before we go into all of those things, something that I didn't mention, but because we have had time to connect, tell me a little bit about how you were saying that you brought, kind of like oral products, if you will.
Yeah.
And forgive me, you take over because I don't want to say it incorrectly, but into the prestige, into Sephora, for example, from, our drugstores, for example.
Yeah.
Right? And this is happening in beauty right now. Actually, some of our clients are coming from actually kind of the opposite, like Sephora, and it's like the balance of it all, doing prestige in some of the big box stores, if you will. But
right.
Interesting, I just realized that.
Right.
But why was that important to you? What did you do? Because that's huge.
So, I was doing a lot of TV, and I would be asked to show them new innovations in the industry. So I was on the TV show The View, and it was 2001, and I brought the new lasers, the new intraoral cameras, I brought a new device, new photography, and then this whitening device, a whitening ampoule, that I had for my patients in my practice only. I go on the show, I go off the show, 7-minute segment, and the gals are all, Joy Behar and the rest of them, are all whitening their teeth, my little ampoule, and they go, oh my God, I can't believe this. It like takes the stain off the teeth, I could tell, and oh, he's so cute, isn't he? And, it was like, they were so funny. Anyway, the phone doesn't stop ringing.
Yeah.
I got 40 boxes. I have it for my patients only. And I go home and I go, Stacy, my wife. And she had a gift and jewelry shop. She understood the whole branding and the marketing and the packaging to create a certain experience and an unpacking. And she had this idea that I should take this product I developed and let's go put it into prestige beauty. Mm-hmm. Long story short, she packages it beautifully in a silver compact, And she gets us into Henry Bendel's
Yep.
by literally forcing her way in the door with Cody, who's about 9 at the time.
I love that.
And they saw it, they loved it. And then she calls me up one day, says, "Don't you know somebody at Saks Fifth Avenue?" And I go, "Yeah, my fraternity brother, he started in the shirt department, but I think he's pretty high up." She calls over there. He's number 2 guy.
I love it.
Wayne. And the secretary says, "Well, he'll get back to you. He's traveling in China probably in about 3 weeks, but, I'll tell him you called." An hour and a half later, she gets a call. I just spoke to Mr. Meichner, and he wants to take a call right away, and he can't wait to see Jonathan, blah, 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 blah. Long story short, we have this meeting with Wayne, the head of beauty, Deborah Walters, who back then, 2002, about Saks Fifth Avenue main floor was the beauty floor.
Yes.
Sephora was a little bit more nascent. Anyway, long story short, Deborah Walters jumps up when she sees this product. She says, "This is unbelievable. This could be on every counter. This doesn't compete with any other brand," because they had every brand, right?
Yeah.
And she wanted us to go into every store of the 70 stores. And
That's
I go,
amazing.
wait. It's unbelievable. It's unbelievable. Except you don't
You have to
understand.
manufacture
We're
everything.
packaging Ampoules in the
Yes.
silver compact on the ping pong table with my in-laws and my 2 children.
Of course.
Of course. I said, "Let's go to 2 or 3 stores and then let me catch up and we'll go build a team."
Smart.
Anyway, long story short, then we go into Sephora and Nordstrom, and that was a company called Ghost Smile, which we sold in 2008.
Right.
And then we started a second company about 3 years later. But, the entrepreneurial journey was really interesting, but it was really Stacy's idea to take this product and put it into prestige beauty, just like they were doing in dermatology
Absolutely.
and hair and the Vakais of the world and the Dennis Grosses of the world.
Right.
And I said, we can do this in oral care.
Yeah.
And Sephora was an amazing partner. They really got it. They really understood under the watchful eye of their CEO, David Sulitiano and Margarita Arigato, who became dear friends of ours, that they would support these young brands.
Right.
And they would bring them to life because of the way they merchandise them, the way they put the powder, their own dollars, marketing dollars behind these young brands.
I love that.
Yeah,
That's
yeah,
really special
yeah.
because that's
Really
not
was.
easy to
Yeah.
find in this world.
Yeah, exactly.
I work with a lot of beauty brands,
And
it's
it's
not
hard.
always so
It's
easy.
so hard as a young brand.
Yeah, absolutely.
yeah.
And then you do get into what people don't understand is you will get into the Sephora, maybe not so much, but some of the other, I won't even name them, retailers
Yes,
or,
yes.
natural marketplaces or
Yes.
big box stores. And people get so excited. But then it starts.
Then sell-through has to happen.
Yes, exactly. I
Right.
mean, it's like, of course, be excited, but there's so much.
There's
People
so
have
much
no
to
idea.
unpack on that one.
So
yeah.
it's nice to know that they do that.
They
And that's really
took-
special.
They took care of us. We built a beautiful brand with them.
Yeah. You found the hole, your niche,
Yeah.
which isn't always easy to do, especially nowadays for all the people in beauty and wellness. And then I love that Stacy did that.
Yeah.
I tell my boys too. I don't
Yeah.
think I've said this out loud. And it, anyways, I always say the squeaky wheel gets the grease.
That's it.
And I'm like, I also sometimes have to practice what I preach. I practice most of the things I preach. That one, I know how to do, but I don't love asking for things. It's like one of my hard things. There, I said it in front of everybody. Even what hotel should I stay in? I'm like, Janelle, just ask the question. It's really
Just
not
ask the
that big of a
question.
deal.
I'll give you a list of 5.
Okay, see, there you go. But I love that. I love that she knocked on the door, and that's the thing.
Oh, yeah. Well, she had this gift in jewelry shop. She was such a merchant at heart.
Yeah.
And she saw it. She connected the dots. Because there's no reason why oral care should just be on a drugstore.
100%.
And it does complete the beauty process.
And she
'cause
saw it.
We
She
know
saw
how
the
important the
vision.
smile is. Exactly. She saw it. For me, I was one of the earliest people in the country to do porcelain veneers. This is in the 80s. I was very fortunate because I met the person who figured out how to etch porcelain and bond it to teeth. I'm 26 years old.
Yeah.
Pretty amazing, Adrian Jerem. And Adrian figured out with a guy named John Gwinnett of Stony Brook of how to etch this porcelain and bond it to enamel. It was a game changer. It created the biggest techniques, the greatest reconstructive techniques, bonded ceramics, because now we bond ceramics not only to the front of teeth, but we have all these high-strain ceramics to the back of teeth where we could be incredibly conservative of our tooth structure. And we call it minimally invasive dentistry.
Yes.
So there was a person who started that, and literally there were 3 of us in the United States.
Yeah.
And I had no idea how big this could get, but it ended up being
Well, that's
one
why
of
you're
the
on the
greatest
experts,
things.
Dr. Jonathan Levine, because you're an expert. But no, yes,
Yeah,
that's amazing.
And we rode that. The industry has ridden that wave, but it created a much more conservative, holistic approach to restorations and to enhance aesthetics for people.
That's huge. Yeah, right place, right time. It's meant to be, as written in the stars.
Yeah.
So I know you were just speaking of this, but I want to dive a little deeper because it's something that people know, but they don't know, but holistic oral health. So now I know what you were just talking about is a little bit different when you say holistic, but I literally mean if we can touch on, because people should understand this, the direct connection to our health and our wellness, particularly, our heart and all the things, and our oral health.
Exactly.
Can you tell us a bit, Dr.
Well,
Levine?
let's just say it this way. We'll start with this.
Yeah.
The mouth is the top of the digestive tract.
Yes.
The blood system is the superhighway of the body, right? What happens in one area, if we have an infection in one area, for sure it's going to go to other areas. Unfortunately, if you have cancers that are going to be spreading, we know what happens with those cancers. Well, the same thing is with inflammation. Inflammation is the cause of every disease known to man, whether it's a cancer, whether it's diabetes, cardiovascular disease, number one killer in America. You go on and on, cognitive function, Alzheimer's, it's all inflammatory disease. So why would inflammation in the mouth be any different?
Yeah.
It's not.
Right.
The bacteria in the mouth that causes the gums to be inflamed, they're called pathogens, these bad bugs. And these bad bugs travel all over the body once you have chronic inflammation in the mouth. So beyond what people have always thought that, I'm just going to lose my teeth. No, you're going to potentially cause amyloid plaque in the brains, Alzheimer's.
Right.
You're going to create a greater plaque in the arteries, carotid artery stroke and cardiovascular disease.
Right.
You're going to end up in the cells between the interstitial cells of the gut, leaky gut. And just like you have leaky gut, which people know about the problem with the leaky gut and the brain,
Yes.
the mouth, when it's leaky, and we call it leaky gums, will find its way to 54 of the systemic inflammatory diseases, which means just basically everyone we can answer and name,
Yes,
right? So with that in mind, you'd say, well, how do I prevent inflammation of the mouth?
Yes.
Right. And you know what's amazing? It is so preventable if you have access to care.
Yes.
And that's number one reason
And
why.
if you're aware of all of this, as I'm saying, I think now is becoming more known, thankfully, to people such as yourself. But I'm certain there are still a lot of people who have no idea the direct connection, you know?
It's true. It's becoming better known.
Right.
22 years ago, the first studies came out there called INVEST studies. Moisey Devereaux's group out of Columbia, right up here in New York City, showed the connection between P. gingivalis, which is the big pathogen of the mouth of chronic inflammation, and cardiovascular disease.
Right.
From that 20 years ago, now they've been named these 54 different diseases where they have direct connectivity, either causation, another one directly connects, or one of the risk factors.
Right.
We'll call it a constellation of risk factors for many of these diseases because it is multifactorial, right?
Yes.
When we know it very well. What happened over COVID?
Yeah.
What happened over COVID is you had people who had chronic inflammatory diseases were so much more likely to end up on a ventilator. Well, if you had periodontal disease, you were 4.8 times more likely from the numbers to end up on a ventilator if you have periodontal disease. Another inflammatory process that is overwhelming our body's defenses, called our immune response, that does what? Gets overwhelmed. In other words, it starts turning against itself.
Yes.
When it turns into self, it creates autoimmunity and autoimmune type diseases.
Absolutely.
Look at rheumatoid arthritis. When periodontal disease goes down, rheumatoid arthritis goes down. Studies done just by Dana Orange out of Rockefeller just came out last year. It's in Nature. And it shows that connectivity. Andrea Kamer's group for a cognitive function disease. You can go on with these amazing researchers. And now, because of this research, we have an incredible growing body of evidence to show that connectivity.
Yes.
And so people have to know about this.
Yes.
People have to know about it. That's why I have my own podcast, and I'm going to have you on because
I can't wait.
The podcast
Just
called
spend my
Think
time
Oral
together.
Health. I have it with Maria Filipova, my dear friend, who's an amazing executive in the industry. And we want to expose this thinking, but also expose the people who are making a difference.
Yes.
Because the mouth is directly connected
Absolutely.
to the
And we
body.
can dive into, this is like the entrepreneur, the mind that I know you share with me, already thinking about this, but we can talk to at that time about, because Eastern medicine, like all of the senses directly connect to certain organ systems, and it's very interesting.
Exactly.
So yeah, I look forward to that. But
preventative was the word that, right? It's so
Yes.
preventative.
So many of these things are. And finally, the world is coming back to, well, our part of the world, modern world. You know, I always say, like the U.S., we're so many amazing things, but we're like babies here. You know, we have many different cultures, but so many of the other cultures have ancient medicine.
That's right.
All the things ingrained in there. So even if you went to them, you're like, do you, in Korea, let's say, because I'm Korean, so I can say this, do you practice, Eastern medicine or traditional Oriental medicine? Like, no. And then you go into their household and you see that they understand a lot of these things.
Right.
From self-diagnosis to some extent, knowing what doctors, of course, at that point, but being aware of our bodies is what I'm getting to. Being aware and knowing how to make that connection, and it is holistic, as you're describing. It's key. Inflammation really is the body like asking for help, basically.
Well, and it's
not functioning properly.
It's exactly right. Mm-hmm. It's the inflammation. We always call it. It's two sides of that same coin. It's designed to protect us.
Right.
But then the other side of the coin, it can hurt us when it becomes chronic.
Yes.
And many of these chronic inflammatory diseases is our choice.
Yeah.
If you're not controlling your blood glucose, you're going to be pre-diabetic.
Yes.
And diabetic. If you don't watch your nutrition and really understand deeply about the factors of nutrition,
Right.
of stress management,
Yes.
of fitness, of sleep, of all these parameters that are important for health, which is really our longevity. If you don't take the time to really understand it, and if you abuse your body, then what's going to happen? You're going to develop these chronic inflammatory. It's going to break down. It's the same thing with the mouth. You really have to have these healthy habits, these high performance habits that will drive the thought of it. You're in tuned enough to say, this is really important for me.
Yes.
Because I want to see my grandchildren. I want to live a long, healthy life. Right. I want to be the best version of myself. I want to help the people around me.
Right.
I want to make a difference. I want there to be legacy. I mean, and that's my mindset. And the people that I know and that I spend time with, I think they share that mindset because we have a choice.
Always.
We really have
Always.
a choice.
I mean, that's like the Tao, my book. The number one of the 8 keys, the first key is know your true self. And what it comes down to is everything in this life, we have a choice, and everything turns back to ourselves.
Yeah, I love that.
Yeah,
exactly.
It applies to everything.
Yeah, and so much of that thinking has worked its way into where people are today, right? We talk about breath work. We talk about meditation.
We're already connected, so I'm like, yes.
And we know, a lot of people are discovering it, and it's fantastic.
Yes.
Because these are old traditional values.
Yes.
That really will take us into a much better place.
Well, it's medicine. Yes, it's medicine. That's why, I have gone out and started teaching just like that. Like I found for so many years, I said it in different ways and made it sound beautiful, I think, or whatever. But finally, I was like, you know what? I've had it. Movement is medicine. Equals breath work, equals all these things. Exactly. How we take care of ourselves. It's all medicine.
Right.
When coming from the correct source, there's also so much out there that is not exactly accurate or correct. But I love that. In fact, that's part of, we can share with the whole world. I'm very proud of this, the airway thing. But we'll get into that in a second because let's dive into why you even got there, which is the mouth mapping diagnostic process.
Right.
So tell us about that, and then we can lead into how I'm your star patient.
Yeah, you are my star patient, and we're about to go there. But
I'd like a picture on the wall when I come into Smile House.
That's right. Well, we're going to start that Smile Wall for sure.
Oh my gosh, that's so funny.
What's interesting about Smile House, it's kind of 35 years uptown at JBL.
Yeah,
and
where
then
do we
I've
begin?
taken that team, which is we have a group of us that have been together over 25, 28 years. And then we have another group of young professionals, but specialists that are of that kind of late 30s category. And it's really a little magical because you got the wisdom, you got the energy, and you're bringing it together. Well, downtown we did the same thing with the energy because I brought my 2 sons into this business who are not dentists but understand kind of these important elements to create an amazing experience.
Yeah.
On the clinical side, what we learned and what I learned as a specialist and what I learned from my own mentors in the industry is that aesthetics is important, and we always start with aesthetics because there's a number of reasons from a standpoint of where the edge of your front teeth are in relationship to the lips and kind of what the aesthetics sets up for. But it's also because most people come to the dentist in the last 10, 15 years because they're interested
Right.
in their aesthetics. But there's this whole world of structure, of in other words, what is the structure of our mouths? And there's a lot of things that impact growth and development that ends up beyond just the genetics for structure. And then because of that structure, there's a certain function that people have.
Right.
Of how the jaws work. The lower jaw is moving, and it's a very unique joint. And then there's the biology, which is the microbiome. It's that whole kind of environment that's created that will determine whether you have a healthy microbiome or a dysbiosis, an unhealthy one, just like our gut.
Right.
Same exact rules apply, just some different bugs. Okay, so we look at mouth mapping is looking at those 4 domains.
I know because I did it.
You were there. Aesthetic, structure, function, and biology. And we look at it because all of our new technology, and this is only the last 10 years,
Right.
allows us to look at things with minimal radiation, to look at a CAT scan for your jaws, equivalent to about 6 x-rays. Intraoral scans, which is no radiation, of course, but intraoral scans, a video of your mouth, very, very detailed, and will tell you how hard you're hitting your teeth.
Which, I'm sorry, for me, this is huge. I highly doubt people know this about me. I'm happy to share. I'm doing it anyways. But I have always grown up with, because my jaw is just the way it is. It's like my father told me it was because I have the strong Korean, like it's my lineage jaw. But I've had some serious jaw problems, TMJ, from the time, I was born.
Yeah.
That way.
Yeah, and we hold a lot of stress in the jaw,
so
as
it's
you know.
huge.
And then intral scan, then we do all this biological stuff with salivary testing. In other words, we look at the microbiome. We want to know what the bacteria are. There's a new company called Oral Genome. We can see risk factors for blood glucose and inflammatory markers. And there's all these things that can happen in a hygiene room that you experience that can allow us to be a tip of the spear to prevent chronic inflammatory disease. What does that mean? We can get upstream, get preventable, because people go to the dentist more than they go to their primary care physician.
It's huge.
So the dental profession has to get going on these innovations because they're very, very new. For me, what I have always been as an academic also is to try to present to the profession, this is where we have to go.
Right.
Of course you can't do it alone. So I have a company called Henry Schein I work with, a company called Benko that I work with. I have the doctors from NYU where I'm teaching that I used to run the advanced aesthetics program. I have great doctors, and you have these companies that are doing all of this digital workflow. What you saw, all the scan. We can design. For the smile, we take pictures.
Yes.
We take those intraoral scans,
Right.
and we design, if you needed it, you got a great smile,
Thank you.
but we design the smile to enhance facial aesthetics.
Yes.
Then we can 3D print that.
Yes.
We can mock that up in the mouth, and we can show a person what they look like. We videotape them and show them what they're going to look like
Right.
before you touch anything. In other words, we can test the design. We can do a test drive. So there's so much that has happened because of technology. So those 4 domains, which the diagnosis at Smile House takes about an hour and a half.
Yeah, I did
And
it. It
then-
was so nice and relaxing and beautiful and so interesting.
Yeah. And then we take all that data and we put all the docs together on a call Friday morning. We all get up early and we go over all that data and we come up with a treatment plan when it's more of these kind of complicated
Of course.
treatment plans. It's like grand rounds for the smile and for oral health.
Right.
And that's unique also. We do that in the graduate programs where I taught, and where I went through myself when I was in NYU. But unfortunately, a lot of these specialists are not under one roof.
Yes.
So that's something that's very interesting because dentistry, remember, it's fairly fragmented. Everybody's got their own offices. And I do believe the practice of the future, like what we're doing at Smile House in my uptown
Right.
office, will have the specialists under one roof, and we can be comprehensive where we're looking at multiple domains
Right.
with new technology in an environment that's very inviting,
Yes.
where we can kind of break a lot of the rules of what people are thinking about. Instead of dreading the dentist, our goal is that people actually will look forward to it.
Yes, and I know you've said it, but let me just make it very clear. Also, you're not just going to the dentist to, forgive me for making it very simple, but I can feel that people will be thinking this, to get your teeth cleaned and to fill a cavity and, maybe get a mouth guard. It's truly now you will be going, as you should be, for all the things you just said, to really get a more clear picture of what is happening on the inside of your body.
That's exactly right. And you can do
yes.
that. We also brought in, it's kind of fun, but we have as you come through the front of the clinic,
Yes.
which feels
Love
like
this part.
a bit of a members club, right? It's kind of this amber feeling, and nothing's transactional up front. You know, it's just people receive you. We have a smile bar. We have someone who does massage of the jaws because we hold so much tension in the jaws. So we have a fantastic person, Grace Campbell, who has studied in London and a couple of the cities in the U.S. to really do jaw relaxation.
Yes.
And when I was amazed, it was almost 100% of the people she worked on had so much tension in their jaws and felt so great after it. Because what does happen, you know, we're in New York. It's like running, and you've got the stress, and you got the deadlines. All of a sudden, you're in a calm place.
Right.
And then you go from sympathetic mode, which fight and flight, to a parasympathetic calm.
Right.
And it's like, when can I do this again? It's that same feeling. So we're changing the whole paradigm of what the dentist, what it looks like, what the environment's like, what our six senses are experiencing, to something that, you know, this was really great.
Yeah.
And that's my goal, to really take dentistry.
Well, you did it, and
up
you
to that
put
level.
it was beautiful. Like I said, I was so grateful I had time yesterday, and you took me through everything, and the amount of mind and heart that you put into everything. That's something that I very much look for in people and what they do, because that is meditation. You know, really, people, that's a whole other conversation, but part of meditation is just truly putting your mind and your heart into something. In fact, I was raised that way. My father taught me, no matter what you ever do in this life, Munchkin, he called me, you put your mind and your heart into something, and that it will make it happen.
And
You'll
will
make it happen. And follow through and work and all the things, work ethic. But
and
I saw
talking
that.
about your dad, I think about my family.
Yeah.
Because I could not do this alone.
Yes.
I have my two sons.
Which I
One's
love.
branding
Oh my
and
gosh.
marketing.
I'm going to bring my boys here to show up. See?
My other son is amazing business,
Yeah.
ops finance. Stacy's unbelievable in design.
Yes.
And it's such a family affair.
Yeah.
And for me, you know, we could all be doing plenty of things. And
Yes.
I probably would have never done this because it's just a lot of work. We've been at it a year.
Yeah.
Now we're open. This is our second week. It is so much joy because we're doing it together.
Yes.
And we're really going after it. And taking the last kind of decades of learnings, and how do we do something special? How do we create, you know, something long-lasting legacy, but truly, you know, innovative,
Right.
that we can uplift, we can raise up, I think, the profession.
Yes.
And for the young professionals that are going to be the next leaders of this profession,
Right.
that they can see something like this, where we can take the innovation and really practically put it to work. Because
Yes.
we talk about the connection of the mouth and the body, but it's like you got to go do it, right?
Yes. That's what I
And
was
one
saying.
of the- that's
Remember
one of
it,
the-
what we're talking about.
Yeah. So you got to get after it, is what we'll
Yes.
say. That's right.
And one other thing I just want to note one more time. So to be very clear, when you walk in, and I'll put this up on social and we'll make a beautiful video because we have so much content, because I had so much fun and wanted to show what you were doing. But for anyone who's interested, and I'm sure you have a lot of that to show as well, Dr. Levine, but you walk in and it's so beautiful. And what I wanted to highlight that you said is the buccal massage.
Yes.
So that's like the mouth, but that's a little different than even this face. Sometimes I'll call it sculpting, which I
Yes.
have a feeling people will like to hear that too, because that is in the beauty industry as a beauty expert. That's one of the most important things. Like gua sha is huge. I was one of the first to ever bring gua sha into this country. Nobody even knows this. I should have said something. And jade rolling 20 years ago.
Right. Right. We're talking about ahead of the
Yeah,
curve
I
on
know.
that.
I should have probably, my people are like, why didn't you tell people that you were one of the first? I'm like, okay, well, here I am. All right. But even seriously, like the ancient techniques that are so many people know now are so good for the sculpting, moving of the chi, circulation, function, flow.
Getting blood flow.
Yes.
Yeah.
It's
It's all connected. There's a new machine we have called M-Face.
Yes, you told me about
It's
this.
from
I wish you had
BTL.
it.
We have it uptown.
I'm going to have to take content, Dr. Levine.
I'm definitely the only dentist in the Northeast.
Yeah.
Plastic surgeons
Yeah.
have it because they have M-Sculpt, and they also now have one for cognitive function. But they have created with radio frequency and something they're calling high frequency electromagnetics sensation. And between those two technologies, they either pulse the muscle or warm the area.
Yes.
And you're going to get collagen synthesis, elastin formation. Talk about non-surgical facelift.
Yes.
And
No, it's a thing.
lifting the face.
Yes. It's called chi, people. If you don't know.
It is. And
Chi and blood circulation. You make it flow.
you make it flow.
Yeah.
You know, and so non-surgical, and you know what it is. It's like you can't start early enough with these types of things that are very conservative.
Oh, absolutely.
But using these new technologies
Make a
and these new
huge
inventions.
difference. Yes, absolutely. And what I also wanted to note was you spoke about Grace, your amazing.
Yes, Grace Campbell.
I don't even know what you call her. Miracle worker.
Well, I'm calling her a myofascial therapist. I'm giving her a new category because we treat a lot of TMJ, MPD, temporomandibular joint and myofascial pain disorder. And we treat it a lot of times with orthotics, night guards. We also use photobiomodulation over the years, Botox.
Right.
But it's really understanding how multifactorial that is, just like every other part of the body is usually multifactorial causing.
Yes.
But we realized that her jaw massage and getting that lactic out of it and stretching in a way that she knows how to do in the buccal, and it's also intraoral into the mouth and the neck. And I can't wait because you're going to be around the city more. I want you to experience it. And every patient who's had Grace's hands on him is like, Jonathan, seriously, this is unbelievable. And I'm having her train every one of my assistants on exactly what she does. So for 2, 3, 4 minutes after every appointment,
That's huge.
we can do that for our patients. So all of a sudden they leave the appointment feeling just nice and really calm.
And once again, we're connected, and we do this together because that's also the point that I wanted to mention is that when you do something properly, you know someone who knows how to do something properly, or you know the proper techniques, being experts, it really doesn't take too long for so many things. That's why I love that you have the 30-minute bar that people can go and do it consistently. That's the other key point here, consistency.
Exactly.
Or even the 2 to 3 minutes. I mean, when I teach the movement and all the things, even when I started the experts, there was a point where I was almost stubborn is not the right word. I don't like being stubborn, but set on doing 15 minutes, like no more than 15 minutes, because I want to teach people that if you do the correct things with someone, with an expert who knows what they're doing, it can take a couple of minutes and literally you can change your whole day. And I love that you brought that up because especially in New York.
It's like brushing your teeth.
Yes.
But it is. It's things have to be repeatable.
Yes.
It's these what
habits.
Brandon Bouchard would call high performance habits. We develop these habits.
We're just going to keep just telling each other like before we say
and
it.
that's it. I mean, I'm tongue in cheek with brushing our teeth, but it's the truth. Yeah. And it's knowing how to do it correctly, the experts.
Right.
And it's not intensity.
Right.
It's really the repetitive action of this.
Yeah.
You know, the mouth, there's always a formation of a microbiome. Mm-hmm. So we have the saliva that's developed to protect us. But
I want to mention that. I'm sorry, Dr. Levine, but you did the pH test. Please go. But that's part of, I don't want to.
Yeah, well, I mean, we can dig into a lot of details of it, but that microbiome testing, we do salivary diagnostic testing where we take some of the saliva, and we use a company called Bristle Health. I love these people, and I'm an advisor for them, and they do something called shotgun metagenomics, but basically in about 7 days, we get a full readout of the microbiome. We do that as baseline. We want to know that. Yes. We also can look at fungi or some of these other type of bugs and bacteria and fungi that could be living in the mouth. Now, everything does live with a balance, as we know, just like the gut. But as soon as you change the environment, as soon as that pH gets too low and gets into an acidic environment, that's when oral health diseases start. What are they? Demineralization and decay when the pH gets too low, because that will demineralize the teeth. And also when the pH is low, it's acidic environment, the bad bugs thrive. They're called gram-negative anaerobic bacteria. They're the same bugs that cause inflammation in the mouth and the same bugs that cause bad breath. Okay. So all of this stuff, if we eat right, if we're not loading up with sugar, sugar is the enemy for our body. It's the enemy for the mouth. So it's the same. Mouth's connected to the body. You know, when it impacts one, impacts the other.
Yes.
You know, so it's our diet. Sodas, low acidic sodas.
Kenny Santucci was here. We're talking about sodas.
We go on and on with this, but you have to create a healthy environment.
Right.
Our body, we're called holobionts. What does that mean? It means that we have more bacteria on and in our body than human cells. You think about that.
Yeah.
Wow. 7 trillion bugs in the gut, 7 billion bugs in the mouth. The second biggest microbiome is the mouth.
Right.
The
so
mouth.
You can imagine, if the balance goes off just a bit, that's the whole key here.
Exactly.
And stays off balance.
Exactly.
Which is literally the Tao, living meditation, it's everything that I've rooted in.
Exactly.
And is where.
And how long ago was that figured out?
10,000 years ago. Probably more. I don't know. 10,000 is what I like to say.
There you go.
10,000 years. I'm going to make it a habit of finding a way to say this in every single interview that I have. 10,000 years ago, they talked about these things because I want people to know. Wisdom. and effectiveness. These things are still around because they work.
Exactly.
It's very simple. We
Time
have to go
tested.
back to being rooted in that, and integrating, having the balance of all the modern and the new, but also remaining rooted in our ancient understanding.
Balance of the old and the new. And I think
Yeah,
that's so well
huge.
stated because we need Western medicine. We
100%.
need to be saving lives.
Yes.
But what we can also do, as many of the functional medicine people talk about today, is going upstream, getting preventative, and creating more of a wellness model in this country.
Which it tends to, I think most of us would agree. I have the opportunity, and I'm so, honored to be with some of the best Western medical doctors in all fields, in several different, wherever I'm at. And it all comes down to the same thing, like all agreement of that function and that flow, and knowing, going back to what we said before, it's up to us to be educated enough to understand when we should utilize what. And what I was going to say is modern medicine, I'm finding, different than 20 years ago, is very much acknowledging, as you're doing this certainly, that the ancient medicines, that's kind of what they can do the other things, but let's focus on that is the preventative, that is the longevity, that is the wellness. They're very good at that.
Exactly.
They're very good at that because they've been doing it for thousands upon thousands of years, So
Yeah.
I love that you're saying that. I appreciate
Well,
it.
and it is. It's really, you need both.
You need both.
need both.
And you need to know, yes.
If we had something acute, I
100%.
was just talking to somebody.
Yes.
And he's walking around with a sinus condition for 5 days.
Yeah.
And he doesn't want to take antibiotics.
Yeah, no.
And I go, I don't know if you understand, but a sinus condition become life-threatening,
Yes.
just like an infection, an abscess
Right.
of the jaws
Yes.
becomes life-threatening.
Yes.
It either closes an airway or becomes brain encephalitis. We started our Glow Good Foundation because
I wanna
we
know.
wanted to go after the problem of access to care and the inequality of health care.
Right.
And these areas, we call them dental deserts, where people don't have any dental. And dental deserts are medical deserts also. They don't have access to care. And so we're so fortunate because people do have access to care. They do have access to the education, the knowledge to take care of themselves.
Right.
So, but I'm sorry, but there's no excuse.
Yeah, I agree.
But the problem with dentistry is if you're not preventative and if you didn't get that education young, you get dental disease, you get periodontal disease, and then dentistry gets really expensive.
Yeah.
And then it's hard for people. It really is hard. And thank God we have dental schools and we have foundations who try to help these type of people, which is what we do in the Bahamas.
Yeah, that's so beautiful. And you work with Lenny Kravitz. I love Lenny Kravitz. I saw that.
I do. Yeah, he's my foundation partner. My wife always says, you guys get along so well because Lenny thinks he's a dentist and you think you're a rock star. So I always laugh at that.
I love that. That's very funny.
But,
I'm glad
you know,
I brought it up because you did not tell me this.
Yeah, but no, I came back from East Africa on our first mission. We took a team from my practice and my Stacy and Cody. And we came back and we were taking care of some of the people in Kigali. And there's a whole story about this woman, a Goth, who got her teeth knocked out with a machete at the Holocaust that they had in Rwanda. If we all remember that, where the Hutus attacked the Tutsis,
Right.
and it was external forces that kind of caused this disruption.
Yeah.
And it was really sad, but this woman survived, and a wonderful foundation led by Jules Schell and Jonathan Tugorovnik, which was called Foundation Rwanda, supported the children born out of the genocide who looked like Hutus from Tutsi women. So they were outcasts. So they helped them get educated and get a life and get kind of out of that area.
Right.
So they wouldn't be outcasts. And so we went there. We helped the people. We came back. Lenny was having his teeth cleaned. You know, he had a hygiene appointment. Not getting too personal. Hope he doesn't get mad at me. And he corners me in the office. And he goes, John, you got to help my people. I said, Lenny, you want me to help your people? You're half Jewish. You're half Bahamian. Where do you want me to go?
That's very funny.
You got to go to Eleuthera. People die from a bee sting. They don't have
Right.
access to care. They walk around tremendous pain from their mouths. They think it's normal. And we went down there. And I took the whole team. We had about 27 people in the practice. This was 10 years ago.
Right.
Fast forward, with the help of Henry Schein, we have a freestanding 14-chair clinic in a building the church gave us. We take down 100 professionals, all of my colleagues, people I've trained with us, and it's amazing. Medical and dental. And what I got out of that is what happens when dentistry and medicine work together.
Yeah, I love that.
And that's where the whole idea of dental medical integration at Smile House, where we do all of these new technologies so that when we see a blood glucose problem, we see an inflammatory marker problem, we see a blood pressure problem, we make a direct referral to either to their physician or the group of doctors that we're working with.
Right.
Yes.
Right. That's so beautiful.
Yeah.
Oh, I'm very happy that we shared that. We didn't have a chance to dive into that yesterday.
Yeah,
so
the Glow
much.
Good
So
Foundation.
really, really grateful.
And it's very special. For me, it's of the things that I do that's connected in the profession, it brings the most amount of joy. I have all my colleagues in there, and we help these beautiful people. They walk in pain.
Yeah.
We have oral surgeons, but we don't just take out teeth. Today we 3D print.
Yes.
With technology.
Right.
What used to take a day to do 2
Yeah,
dentures,
totally.
we do 6 printed in an hour and a half.
See, that's
I
the
have-
new. That's the
I have
modern.
4 schools. We have Nova Dental, Alexander Bendayan, Annabella Oquendo, NYU, Michelle Henshaw from BU, Catherine Hayes from Harvard. We go into the schools. Here's the
Yeah.
biggest thing.
Yep.
Michelle and the team, they go into the schools.
Right.
They teach the kids brushing habits, proper nutrition.
So
We
smart.
screened them in the beginning. This was about 10, 9, 8, 7 years ago. We've been in all the schools a few times.
Right.
They will never grow up like the parents.
Yes.
Which have all this dental disease. And now
Yes.
they're educated.
Right.
And we really see that evidenced by what happens year over year. When we go into the schools and they look at 70 kids, 40, 50 of them end up in the dental chair. Now they go into school, they look at 70, 80 kids, 5 end up in the dental chair because they've had an impact. Because they understand diet, they understand, what tools they have to use to keep their mouths healthy. So, you can have an impact in the community. You really can. And it really starts right
Absolutely.
at the beginning. Yeah.
The smile is the gateway to longevity. I loved that. Our time is up.
This was
I can't
great.
believe it. It was
I had
great.
so
I
much
mean, I
fun.
knew this would happen. That's why I was like, I have to look at the clock because I'm pretty certain we'll just sit here like we did yesterday and talk for like 6 hours. And be like, oh, shoot, it was supposed to be an hour. Anyways, please tell everyone where they can find you. Of course, Smile House Tribeca. When is the grand opening?
Yeah.
Or am I putting pressure on
No,
you?
well, so my son, the branding guy,
Yes.
it's Smile House.
Yes.
So we're going to have a house warming party
I love that. Love it.
on his birthday,
Oh, when is his birthday?
May 13th.
Okay. Oh, that's a day after Vince. My
So
Vince
we-
is May 12th.
Oh,
So it's
there you go.
Yeah, there you go.
There you go. That's it. And it's good because it's going to give us kind of that month and a half plus
Right.
to really get the house in order and get everything set up the way we want to get it set up. You can find us at smilehouse.co. I'm at Dr. Jon Levine,
Yeah, I was
Dr.
gonna
John
tell you.
Levine, and all that good stuff. And the uptown practice, the northern one, is jblnyc.com.
Yes. Love that because my lab, I don't even know if you know this, is JBK Wellness Labs. So, to me, that was a very, very close.
That's pretty
I
close.
was like, okay, whatever, Janelle.
JBK, JBL. I mean, you're only one letter behind on the K.
I like it. I don't know. It's not really important, but
That's
just wanted
funny.
to acknowledge that. Amazing. So yes, on social, on your websites, if you're in New York or traveling, you have to go and check out Smile House Tribeca. It is an amazing experience. So grateful for all that you do. And I can't wait for so many more conversations with you, Dr. Levine.
I look forward to it. Thank you for having me on.
Thank you for being here.